Hello, my name is Veronica Ajewale. I'm an associate professor of pharmacy practice and the director for the Community Engagement Core of the NIH-funded Center for Biomedical and Minority Health Research here at Texas Southern University. I want to say a big thank you to you and the community members for joining us for today's program. We are really excited that we will be sharing a lot of great information alongside the experts or speakers and panelists that will be leading us into this conversation. So please have your questions ready. We would have an opportunity to take your questions after today's presentations. So thank you again for joining us, and we look forward to our continued collaboration. Thank you.
Okay, well, like I had said, my name is Jana Dominguez with Harris County Public Health. This is our third year hosting this Healthy Cooking Challenge. Today we have amazing vendors here for you guys to go and talk to. And we also have chefs ready to make some food for you. But before we get that started, I did want to introduce the amazing people that have helped me to make this event possible. And yeah, let's get started. I want to first start off by introducing my team here from Health Promotion, which is Kari Hateable, Ariana Kosovan, and Michelle Cajero. Thank you all so much for all your help. We also have Arian Braxter, she's an engagement specialist. Abha Dikikari, she is conducting a survey later, so please fill it out. And Mariana Rendon, where is she? She is our registered dietitian who will be educating later to you guys. To continue, today we have doctors from McGovern Medical School at UT Health Houston. With us we have Dr. Taylor Hopper. There she is, she's wearing an orange shirt. Thank you for being here. And also Dr. Stephanie Badge. Both of them are internal medicine resident physicians, and they're ready today also. They have an awesome presentation for you guys. Next, I know you guys are here for the main individuals to try their food. We have our awesome chefs. So the first one I wanted to introduce is Chef Adrian Clayton, representing HISD, Barbara Jordan Career Center. She's the one over there in all red. And her sous chef. Her sous chef is Chef Chloe Walker. I would like for y'all chefs to please come over here. Come over here, so say hi to the camera as well. So there you go, there's Chef Clay, the camera's right there. Okay. Next, we have Chef Marcus Flakes with Pantria. And his sous chef, Dolores Allen Flakes. Beautiful couple. Okay. Next, we have Chef Juju from Cafe Juju. And her sous chef, Chef Robin McNeil. Last but not least, making his return is Chef Daniel Pinesick with Pinesick Soul. And his sous chef Jose Chavez. So this is the lineup that we have here for 2026. They're going to be preparing some heart-healthy dishes for everybody to try today, especially those that have a wristband. So raise your hand if you have a red wristband. Woo-hoo! Come on over, come sit down. You guys later today will be able to judge, taste their dishes. Thank y'all for being here, chefs.
I was calling you because it was calling me. No, ma'am. I'm sorry.
You're fine. For TSU, I want to say a huge thank you to Monique Gongora, Dr. Jones, and Saneha George, and also a special thank you to Dr. Veronica Ajewale Nawama. She is a professor of pharmacy practice and director of the TSU Center of Biomedical and Health Research Community Engagement Core. They are recording this event to the individuals online. The recording will be available on all of their YouTube platforms. So if you have any questions on how to find their YouTube, we have them right here. Dr. Jones, please raise your hand. You can come and ask her so you can find this recording later. Moving on to Harris Health, we also have Harris Health in the building. They're representing, we have Kyle Maroney, he's the Community Health and Wellness Manager. And Lasana Barron over there, woo! They're both work at Harris Health, Sheila Jackson Lee Center for Accelerating Health Outcomes. Next, I do want to say a huge thank you to the individuals, the programs, organizations that help us distribute this flyer. I'm going to start with Northeast Houston Redevelopment Council, President Huey Wilson, and Vice President Ken Williams, representing Trinity Gardens Super Neighborhood 48. Woo! Thank you. And next, President Keith Downey, representing Cashmere Gardens Super Neighborhood 52. Thank you all for helping us distribute this flyer. Also, whenever you get a chance, visit Harris County Public Health on Instagram and Facebook so you can see me doing my acting debut. We did an amazing short for Instagram where we were presenting the Healthy Cooking Challenge, and it's fun. Go ahead and go look at it. And also, thank you to HISD, a special thank you so much for opening up the doors for us to come and have this Healthy Cooking Challenge. It's a great event, making it possible for community to learn about what they're going to learn today, which is cardiovascular disease and how to live a healthy, heart-healthy lifestyle. And those with HISD, thank you, Mr. McAlpine, Mr. Ford, Ms. Chris Robertson, Ms. Stacy Hammond, Ms. Edith Mason Ferguson, and a special thank you to Dr. Donna Kermush for donating this space and the security. Thank you so much. The security over there and the security for keeping us safe today. And last but not least, the vendors, thank you all so much for being here. Please, everybody go and talk to them. They have amazing resources. They have free resources for you to take home, a lot of great education. A lot of education that you can learn and also teach your family. And so your children can also learn about the free resources and education that are here. One special note before we get started. If you see your table, there is a QR code for the Area Agency on Aging. They're conducting a survey for older adults here in Harris County. They will love your insight. So anything that anything that you want to let them know on how they can better services for older adults here in Harris County, please use that QR code. We will be conducting a lot of different surveys from Harris County Public Health, Harris Health, and TSU. I urge everybody in the community, please fill them out for us. If you fill out these surveys, they help us to create awesome free events like this to you guys, for everybody in the community. So now, you might be asking yourself, okay, Joanna, you said thank you to all these individuals because they've been helping us a lot. But now I want to talk to you about the purpose of the event. The purpose of the Healthy Cooking Challenge. Like I said, this is our third year hosting the Healthy Cooking Challenge, which is hosted every February. We hosted in February to align with Heart Health Month and raise awareness about cardiovascular disease, or CVD. CVD refers to heart disease, heart attacks, strokes, or heart failures. And today we'll be able to learn about all of those different cardiovascular diseases from our doctors. Unfortunately, CVD continues to impact families and communities here in Harris County, and we have found that it's very important to continue to educate and bring awareness about these diseases. And the way that we're doing it is by education and also having chefs prepare heart-healthy dishes. They're going to be delicious for you guys to try, and then hopefully incorporate them in your lifestyle, in your kitchens, and also show them to your families. Maybe you might have a recipe that has been passed down from generation to generation, and there's a little thing that maybe you can do to make your little heart healthier. You will be able to learn that here today by learning from the doctors, also the chefs, and our registered dietitians. Now, you might be asking, what are we going to do if we have these wristbands? Well, yes, today you will be able to vote for the best heart health dish of 2026. Each chef will prepare a small plate, a very small plate. Let me put it down so I can get it. It's going to be this small. It's about 4 to 5 ounces of food that you'll be able to try. It's going to be 4 different dishes that are going to be plated right next to you. And you are going to be our judges. Everybody that has a wristband, you're going to have to judge for the best heart healthy dish of 2026. Whichever chef gets the most votes, they'll be the one that wins today's challenge. Isn't that exciting? Yes. Let's see if I'm right on time with everything. Okay, perfect. So, I hope you guys are ready for a fun day of education. I did want to pass over this mic over to Michelle Cajero. And one last thing I did forget to mention. Now, the chef did not know what ingredients we have for them. These ingredients have been selected by myself and the rest of the health promotion program and registered dietitians. All of the ingredients that we have selected are the ones that you might know, but we are making sure that maybe if we grab ingredient A, it's lower in sodium, right? So that's the way that we decided to change it a little bit. And right now, Michelle is going to show the ingredients that we have to you guys. It's going to be the first time the chef's seeing the ingredients that we have as well. So, Michelle.
Great. Thank you so much, Joanna. Everyone give a round of applause to Joanna for being wonderful today. Again, my name is Michelle Cajero, and I'm Health Promotion Coordinator, also in Harris County Public Health.
Hello.
Hello. And today we will be, as Joanna mentioned, one second. We will be unveiling the ingredients. I think that's what everyone wants to know. What are the chefs cooking with in the first place?
Carlos,
Yes, we're having technical difficulties.
una pregunta.
Broccoli. I heard someone say broccoli. That's a good guess. Carrots. Yeah. Cauliflower. Veggies galore. Brown rice. Good whole grain. Yes. What about oils? What kind of oils do you want to use? Olive oil? Yeah. Yes. Coconut oil is also a good option. Canola oil. I know it gets a bad rap, but it's pretty good. It's pretty good. It's our healthy now. I know our registered dietitians will go over that today, but yeah. What are some favorite seasonings that you guys use at home? Mrs. Dash, yeah, shout out to Mrs. Dash. Anything else? How about Tony's? Italian seasoning? Yes. I noticed they sell them at Marshalls and Ross. Like they have those bottles, and I'm like, wow. I see you, Marshalls. Oh, Lars. Yes. In the meantime, if you identify as an older adult, please take the Harris County area on aging of Las Vegas. they have their survey here at the tables, and they really appreciate your feedback on how we can support services for seniors and older adults. So there's a QR code at the table.
Also, for our online attendees, drop on in the chat in the comment section. Please let us know what ingredients you guys think will be on bill today. Would it be broccoli? Someone said broccoli here. I don't know. I'm looking at like I don't know what we're having. But in the meantime as well, with our awesome vendors that we have here, we have a petting zoo outside. Yes, we have a petting zoo. Isn't that so cute? Oh my goodness. Yes, we're next to the farm, right? So you guys wanna go touch some animals, go ahead and do that. I can't wait to go over there later to go interact with them. In the meantime, I did want to talk about a little bit about Harris County Public Health and what do we do. For those that are just getting here, I apologize, we're having some technical difficulties. And what we do here at Harris County Public Health, we are a large public health agency located where? Harris County. And we have a lot of free services. One of the ones that I love to talk about is nutrition and physical activity program, which is with Mariana over there. They host free educational classes about nutrition and physical activity. So if you have questions about that, please reach out to her, reach out to me. But everything's fixed.
Awesome. Thank you so much, TSU. Shout out for them to help us. All right, so let's get started. The unveiling of the ingredients. But before that, if you have allergies or food sensitivities, please pay careful attention to this list. We want to make sure everyone is safe. And please let us know if you do have an allergy before tasting bans. All right, so who is familiar with the food groups? Maybe with my plate, the pyramid. There's an upside down pyramid now, apparently. So we'll start with fruits. We have lemons, beets. Who eats beets? I feel like not a lot of people eat them. Okay, lots of people eat beets. Awesome, so they have canned beets. We also have limes, which is essential. Jalapeno peppers are actually going to be poblano peppers. HEB does not have them, but poblano peppers are a good alternative. Pineapples. We also have plantains. Plantains are different from bananas. We also have frozen mango chunks, gala apples. Now, going into the vegetables and herbs, we have lots of frozen veggies that the chefs will use, including broccoli and mixed vegetables. They will also be using bell peppers and cilantro, again, very key staple ingredients that a lot of people use. Green cabbage, 12 heads or bulbs of garlic. These are all fresh. Iceberg lettuce, Italian parsley. And then we also have canned whole kernel corn, and it doesn't have salt added to it, which is the point of today's, right? Heart-healthy ingredients. Roma tomatoes, also very common. Sweet potatoes, zucchinis, baby spinach, red onions, and red onions. But wait. Dun, dun, dun. We do have a surprise for the chefs. They do not know this, but thank you to the Barbara Jordan Career Center and LBJ Hospital Community Farm. They provided farm ingredients. So this will be kind of like the bulb onions and then carrots. I already looked at them and they're huge. You wouldn't think that they'd be from a farm, and they're huge, especially the carrots. So thank you so much to Rebecca Firm. She's the head farmer for that facility. Now going into ground chicken breast. And then for our plant-based folks, we have extra firm tofu and salt-free lentils, again, canned. And chickpeas, black beans as well. And then lastly, I believe this is the last category, is the grain. So when looking at pasta, we chose whole grain. So whole grain, penne pasta, brown rice, quinoa, I believe I'm saying that right. It's the tri-colored box one. And then dairy products. We have reduced fat Mexican blend shredded cheese, as well as non-fat plain Greek yogurt. And then again, for plant-based friends or people that can't have dairy, like me, we have unsweetened plain cashew and coconut yogurt. Now, for oils and seasonings, we have apple cider vinegar. I'm not even going to try to pronounce it, but it's Worcestershire sauce, I think. Canola oil and extra virgin olive oil. Then we also have salt, black pepper, cornstarch. And then these are other seasonings: chili, garlic, onion, and cumin powders. And then someone said Mrs. Dash, of course we have to include her. So we have the Italian medley and the original blend, as well as smoked paprika. And then nutritional yeast, which is used as a dairy substitute. It's kind of a cheesy seasoning for those who haven't used it. So again, that's for our plant-based friends. And then other supplies that they have is water. But yes, it is about to be 11:30, so the chefs are going to start right now, and I'm going to go back there and help them out. But thank you guys for listening. Apologies for the technical difficulties, but I'll pass it back to Joanna.
Thank you, Michelle Cajero, for unveiling the ingredients. So some of y'all were right. We did have some of the ingredients that you guys said. Mrs. Dash is one of them. Now, I did want to put a quick, let you guys know that we have clinical health services from Harris County Public Health. Can you please raise your hand? They're here to provide free health trainings. Please, if you need a health training, please go up to them. They'll provide it for free. Thank you guys so much for being here. And once again, all our amazing vendors, they have awesome resources. Thank you vendors for being here. Okay, now it's time. Y'all, you guys are ready to learn from our awesome presenter that we have. And I wanted to go ahead and start with our doctors. Doctors, can y'all please come over? Okay. I can't wait to learn. Thank you so much for being here.
Of course, here you go. Hi everyone, my name is Dr. Stephanie Batch. I'm one of the resident physicians in the internal medicine program at UT Health Houston McGovern School of Medicine. Actually, in the back here too, I want to give a shout out to one of the chief residents, Dr. Taylor Hopper. And our program director is here too, Dr. Robbie Wesley as well. So, we are here to do the serious business talking about heart health and talking about the medical side of things. So before I continue, everyone can hear me, and my voice is a bit quiet, so I just want to make sure everyone can hear me. This is serious business, okay? It's very serious. So happy Heart Health Awareness Month. Yes, I said that right. And we'll learn a little bit about heart health and some things that you want to look out for, like heart attack, stroke, other serious illnesses that if it happens out of the blue, out of the community, you know what to look for and what to do in the sense of like emergency like that, okay? So very serious business, but I'm happy to be here. I'm happy that everyone else is here to learn with us. So that's me and Dr. Hopper up there, as well as Dr. Ma, who also is pretty much the founder of these heart health series, and he's done a lot of great work with getting this education out to y'all. So some key learning items I want you all to take away from this session. This is just like being in school again. So I want you all to be able to understand and scope out key risk factors for heart attack or stroke. So if you know someone in the community is having one of these happen, you know the danger signs. What to do when you see these symptoms, and then this is going to be more for a registered dietitian right after this session, but nutrition, eating habits, and other important preventative factors you can do.
And early before, hopefully this will never happen, but before these kinds of things might be a worry sign. So, heart attack definitions. What is a heart attack? I was gonna poll the audience to see if anyone could give me, but I have the answer right here. So, what is a heart attack? It is not the heart stopping. That is something completely different. A heart attack is a plumbing problem. This is basically, as you see in this very technical image of the anatomy of the heart, there are arteries that feed the heart muscle that gives it oxygen, energy, and ability for the heart to squeeze. The heart is a muscle, just like these puppies right here. Look at these puppies. It needs oxygen and energy for the heart to squeeze to get blood to the rest of your body. So if that artery called the coronary arteries that lead to the heart, if those fill with plaque, increased cholesterol, or any other blockage, even if the artery gets squeezed down on itself, that means that the heart is not getting that oxygen, and that heart tissue will start to die with anything else that doesn't have oxygen. So that when one of those arteries gets totally blocked out, that is what we call a heart attack. So what it is not, the heart doesn't stop beating during a heart attack. That is something called a cardiac arrest. You see that like in the movies where people start to do the chest compressions, the CPR, that is when the heart itself stops beating. But a key differentiating factor is with a heart attack, the heart is still usually beating, it's just not beating as well as it could be. So some risk factors, this is really important. So there are very important things that if you have these or if you engage in these behaviors, you're at higher risk for a heart attack or a stroke or other illnesses that I'll talk about. So a big one is high blood pressure. So who here has high blood pressure? Who has been diagnosed with high blood pressure? I know there's quite a few. It's a very common thing. So if you do have high blood pressure, that means that your arteries, it's taking much harder for it to kind of pump blood through because there's more blood pumping through it, making the pressure through those arteries a lot higher than it normally should be. High cholesterol is another one. Cholesterol builds up in the arteries. If it does that, blocks it off. Smoking is a very, very big risk factor. Actually, in a lot of the medical studies and journals that we know today, smoking is one of the highest risk factors for having a heart attack. So if you smoke, it's important to understand this, and then also when talking about strategies to come off of smoking, smoking cessation, and working on that, because it is actually, if not the highest, it is one of the highest risks for heart attack and stroke. Diabetes is another one. If you don't have your blood sugar under control, it also increases the risk for heart attack, as well as some other things. So age, the older you are, how active you are at home, if you have a little bit more weight, so if you are obese, that has more cholesterol building up in the arteries and veins and other things that causes the heart to need to pump a little bit harder against those factors. And then other things that we all have to deal with, stress in daily life, sleep, diet, all of those things. So one thing you'll notice is that some of these are controllable, some of them are not. Things like diet, sleep, stress, smoking, those are all things we control. There are other factors that genetics does plays a part. You can't really, change those things if you have kidney issues, family history of cardiac disease, any other things like arthritis. You can't control those. So you'll notice the stuff on the left side is the stuff that we can control. So y'all just being here today is already taking a step towards having a healthy heart and healthy heart habits. So, very important slide. These are warning signs to look out for if you are out in the community, out at HEB, and start to see someone do this, or you start to feel it yourself, God forbid. But these are the symptoms: sudden chest pressure, tightness, if you feel like an elephant is sitting on you, That is a really important and common presenting factor that we see in the hospital. Other common signs are pain, discomfort that can start at the jaw, spread to the shoulder, neck, teeth, sometimes right here in the upper belly. And then lightheadedness, dizziness, sudden nausea or vomiting, cold sweats, or an impending feeling of doom. Those are all really classic signs for heart attack, okay? Okay. So, misconceptions. Y'all have seen movies, yes? We have all seen movies and TV shows. These are not always an intense, dramatic thing. Like you see someone in the movies, they're like, like Tony Soprano, like they're on the floor and it's very obvious. But in real life, sometimes these can happen a lot more insidiously, a lot more slowly, or sometimes there's something called a silent heart attack where you could feel nothing at all, but those arteries going to your heart are still blocked up, so your heart is still not getting that oxygen. So it's actually a lot more insidious than we think. Another important thing to know, we talked about the classic warning signs. So for women, sometimes they can present with less classic signs. So they might not have the pressure on their chest, but they might more frequently have shortness of breath, jaw pain, nausea, or pain right here in the upper belly. So sometimes they don't get very classic. So it's important to look at these signs too. And above all, if you don't feel well or feel like there is something wrong, then to go to the emergency room as soon as possible or call 911. So this is all the things that we talked about, all of the common heart attack warning symptoms. This is all in the American Heart Association. So if you want to learn more, you can always check out their website with their resources. So what are we going to do if we see this? First, call 911. 3-digit number for a reason. It's really easy to remember. Other things, this is a very wordy slide, but we're going to work through it. So if someone is having a heart attack and they're like standing, have the person sit in a comfortable position. If they're wearing a tie, loosen the tie. If they're drowsy or they're not responding as well, you can put the patient on their side where they're laying down, which is known as recovery position. So this allows them from, if they have saliva, it won't go back and, cause issues into their throat. If they have known heart issues, ask them if they have heart medications. Something called nitroglycerin is a very important heart medication in times like this if they're having a heart attack. So if they have that and you know that they take it, then get it and then give it to them if they're able to take it. If they aren't able to talk to you or respond, they won't be able to take a medication, okay? Stay calm, very, very important step. And then the last thing we'll talk more about, CPR. That stands for cardiopulmonary resuscitation. We'll talk more about that later. But again, in a heart attack where the patient or a person is still talking to you, still has a pulse, still able to describe to you what's going on, we're not pressing on their chest, okay? That'll come in specific emergencies. Another thing, stroke. Also an issue with cardiovascular disease. So we talked about heart attack. Stroke is also a very serious emergency that can happen if you have uncontrolled cardiovascular risk factors like high blood pressure, diabetes, high cholesterol. So this is a brain attack. So blood flow carrying oxygen to the brain is blocked. So like the heart that can't work without blood, the brain also can't work without blood and oxygen. So these are the warning signs for stroke. So this is the mnemonic. It's called Be Fast. It's a bit hard to read that, I'm sorry, but kind of going through it. So if someone starts to get off balance, they're stumbling, or they have changes in their vision, it starts to get blurry, they can't see as well. If you start to see drooping of the face, especially on one side, that is a huge marker for stroke. And if there's any weakness on the side of their body or their face, or they can't talk as well, they're slurring their speech, then those are all signs for stroke. So the last part of this mnemonic is T for time. So what to do if you're seeing someone has these symptoms for a stroke? Call 911 again. That's the first thing. The most important thing is if you're seeing this happen, you write down the time when you start to see the symptoms appear, because that is really important for us health professionals health professionals to know what we can do to give them interventions and provide medical care. Again, with the positioning, that recovery position we talked about before, keep calm, keep them awake. Do not let them just sleep it off, because that's just gonna make things worse. So try to keep them awake. Do not give them water or medications, because if they're having a stroke, they're getting weaker and weaker and weaker, right? So if they can't swallow anything, if they can't take any meds, it's just gonna make things worse. They could like choke on it or worse. So try to keep them awake. Don't force them to drink anything or try to get them meds. Okay, so I do have a quick video as well talking about CPR. So we're gonna watch that in a bit. It's a 2-minute video. But has anyone ever seen CPR be done before? While we wait. A couple of hands. Have y'all seen it done in real life? And yeah. Have you seen it done in movies? Has anyone seen a movie or a TV show with like the EMS providers up there up front? Very good, very good. So you'll see, like, it's a simple thing. Like, they literally press on the chest in an attempt to restart the heart. While we wait for that to start. So that's literally a manual way to try to get the heart to pump. So we'll watch this quick video to show you how it's done.
Cardiopulmonary resuscitation, or CPR, is a life-saving technique for someone who has collapsed, isn't responding, isn't breathing, and doesn't have a pulse. If you see this happen, call emergency services right away. Then you'll need to keep the person's heart beating and make sure they're getting oxygen until help arrives. Here's what to do. Number 1, position the person. Make sure they're lying on their back on a firm, flat surface. Number 2, check for breathing and pulse. If they're not breathing or don't have a pulse, start CPR. Place one hand over the other with the bottom hand's heel on the center of their chest, just below the nipples. For infants, use 2 fingers. For children up to 8 years old, use 1 hand. Number 3, perform chest compressions. Using your body weight and keeping your arms locked, push down hard about 2 inches deep. Let the chest rise fully before starting the second compression. Do a full set of 30 compressions quickly, about 100 to 120 per minute. It helps to follow the beat of a song like Stayin' Alive by the Bee Gees. Give 2 rescue breaths. After 30 compressions, pinch the person's nose, tilt their head back, lift their chin, close your mouth over theirs, and blow 2 normal-sized breaths into their mouth. Make sure their chest rises with each breath. If it doesn't, check to make sure nothing is in their mouth blocking their airway. Number 5, repeat. Continue this cycle of 30 compressions and 2 breaths until the person starts breathing on their own or emergency help arrives. The sooner CPR is given, the better the chances of survival. Keep this information handy in case there's ever an emergency.
Welcome to segment.
Quick shout out to our tech help. That was really great. I don't know how to open YouTube videos on my own, so I really appreciate them being here. So that is a rundown on what to do if someone has lost their pulse, they stop breathing, and you can't feel for a pulse. I give this information for everyone because according to the Center for Disease, the CDC and other many important medical sources of information has told us that even if you don't have CPR certification, doing something like starting CPR regardless is way more important to increase the chance of survival for someone who has lost their pulse and their heart stops beating. So if you know how to do it out in the community and you're the only other person around, it's important to know what to do so that you can help save a life and get them living longer. So again, like the video says, make sure you check for a pulse first, because if you feel a pulse and they're talking, you don't want to start banging on their chest, right? So for the CPR itself, it quite literally is going to be pressing on the chest. You can use Staying Alive to the Bee Gees. There's a couple other songs with the same amount of the BPM. It's whatever you like, but that just helps give you a general rhythm for the heart to beat properly and regularly. So with CPR, they mentioned also giving the breaths. Actually, for community members like yourself, it's much more important to do the compressions rather than stopping and giving the breaths, especially if you don't have CPR certification. So focus on giving the compressions and have 911 called before you even start, especially if you're alone. If someone else is around, make sure that they can locate the nearest AED, which is a device used to help shock the heart, which y'all have also might have seen in TV shows as well. It's important to get them to locate the nearest one so you can get pads on quickly and wait for the EMS providers to arrive so that they can take over. So that was a lot of information, and that is CPR. Let me see what is next. What next? Okay, so before I kind of go on to this next component, because a lot of this is actually going to be covered by a registered dietitian in the next talk after me, I do also want to talk about something called heart failure, because it is something that our speakers at the beginning brought up. So I do want to mention it as a quick aside. So we talked about heart attack. We talked about stroke. Another really important thing to know is a disease process called heart failure. So if you've heard about that, if you know someone with heart failure, it's someone whose heart is weak or it's not beating as well to get the blood and oxygen to the rest of your organs. And actually, if you do have a heart attack, usually after the heart attack, you do have some degree of heart failure depending on how severe it is. So what is heart failure? I said it before, but it's quite literally a heart that is too weak to beat properly. So some symptoms of heart failure is increase in fluid into the lungs or to your legs. Because the heart can't beat as well, the fluid going through your veins and arteries may start to get a little bit leaky. It starts to go into your legs. It starts to go into your lungs. So if you know someone with heart failure, you'll see that it might be a bit hard for them to do exercises or do other things. Another important thing for heart failure, heart-healthy diets. Part of the reason why something is considered a heart-healthy diet is because it has less salt than what is usually in a normal diet. Increase in salt, increase in fluid in your body. It's science, it's something with osmosis. So like the more salty foods you have, then the more fluid that starts to rise up in your body, and then it causes something called a heart failure exacerbation, where you start to get the fluid build up in your legs and you can't breathe as well because there's literally fluid going into your lungs and other areas. So if you have heart failure, if you know anyone with heart failure, usually you have a cardiologist or have someone that you follow up with regularly, which we do recommend, in order for them to manage it with medications and appropriate exercise regimens and diet. So another really important thing, I wish I did a slide on that too to give y'all some nice pictures to look at, but it's also something really important to talk about, okay? Prevention strategies. You are here today as part of prevention strategies too to get information and education. So nutrition and healthy eating. I have some slides on this, but I know that the dietitian will go over it much more in detail. But in general, for your foods every day, eat breakfast, lunch, and dinner, but try to go easy on the sweets, on the Coca-Cola, the Diet Pepsi, the Dunkin' Donuts iced coffee that I like to drink too. But it's really important to kind of watch what you're drinking, how much sugar you're putting into things. If you eat a lot of fast food, trying to look at the nutrition label by Googling it online and seeing what is actually involved with what you're putting into your body. And then other things are red meats, processed foods. Another thing is increase of saturated fats. If you heard saturated fats as a term before, it's something that's in like butter, fried foods, all of these really, really yummy things that can also be really harmful to your health if you eat too much of it. So let's focus on Our chefs back there are literally cooking these amazing meals with the ingredients that we just saw that are heart healthy, because it's things like whole grains, leafy greens, fiber-rich foods that are all really, really good for your heart to keep it really healthy and working strong. So again, this is just a little demonstration of how much sugar are in certain drinks. I'm focusing on drinks because us Americans love our sugary drinks, but you'll see, like, even with that sweetened iced tea, us in Houston in the South, we love our sweet iced tea. It could be up to 40 grams of sugar or even more if you look at the nutrition label on the back. And then just talking more about desserts. For fruits, I will say, so this is a question we get a lot in clinic too. Fruits do have an amount of sugar in them as well. So we get a question of like, hey, should we stay away from fruits because it also has sugar and all those things. But from what we know is that if you are literally replacing like say a cookie after dinner with instead like a mango or like some kiwi, it's completely different, the amount of sugar in each of those things. Like it's quite literally a mountain versus a little molehill. So for our patients, usually we tell them, yes, fruits do have sugar in them, and it's important to know that. But if you're using it to replace things with more sugar to it, it's going to be healthy regardless. Okay. Controlling blood pressure. This is also really, really important. So if you have high blood pressure or know someone or you have someone you love that has high blood pressure, please keep a log at home. If you have a blood pressure monitor at home, that's really important. But also you can get it checked at H-E-B, Walmart, CVS. All of those places have blood pressure monitors that you can get checked for free as well. And we do have our blood pressure screenings in the corner too, so please go ahead and check your blood pressure. I recommend it. If you do take medications for controlling blood pressure, please take your blood pressure in the morning and evening and before you take your medications to see how high your blood pressure is before and after you take your meds. It's important for us to monitor how well the medications are working. And then if you have symptoms like dizziness, headache, chest pain, shortness of breath, and you know you have high blood pressure or you have a monitor lying around, it's always a good idea to take that measurement too to see if it's really high. Normal blood pressure is 120/80, so anything above that is going to be high blood pressure. Okay, more prevention strategies, and I'm actually going to finish a little bit early because I'm talking a little bit fast, so we can talk more about questions if y'all have it. So understanding your own personal risks for cardiovascular disease, CVD, and other medical diagnoses is really, really important. So getting regular checkups with a doctor and having a primary care physician to help control those risk factors is really important to prevent issues like, heart attack or stroke or any other really scary things in the future. If you're smoking right now, focus on trying to cut down on smoking if it's difficult to quit altogether, or talk with your doctor too. You can talk about cessation strategies for smoking as well, because we talked about it before. Smoking is number one, or one of the highest risk factors for stroke and heart attack, okay? And then for exercise, so this is really hard for me too, personally, struggling with it. So I know it's something to tell our patients like, hey, just do this. It's a bit hard. But try to aim for about half an hour to an hour of daily exercise if you can. But ultimately, the goal is to try to get 150 minutes a week of anything that's moderate exercise. Anything that gets your heart pumping. That could literally just be doing jumping jacks at work, or my personal favorite is doing dancing games at the arcade. So I'm a little nerdy like that, but that's the way that I can get my heart pumping. It could literally be anything. If you're walking your dog even gets your heart pumping. So anything that gets your heart pumping. It doesn't have to be going to the gym, going on the treadmill, because not all of us have access to a gym, and not all of us really think that going on the treadmill is a fun activity to do. So whatever you find works for you. I recommend it because studies have shown 150 minutes a week of moderate exercise, which means that you can still talk, but you can't sing or yell, is good to keep your heart healthy and strong. Another thing is 75 minutes of rigorous exercise if you like to do that HIIT stuff, or Pilates, like hot Pilates. I've never done it. It's scary to me, but I've heard that people love it and it really gets their heart pumping really well. And then please, please, please get regular checkups at your doctor. If you're pretty healthy, that's usually just annual visits, but otherwise just checking in with them to make sure everything's going well and you are taking medications that are right for your body. Really, really important to prevent very serious things. So I am a little bit early. There's more time than the 7 minutes for Q&A. If anyone has questions to ask a doc or multiple docs over there, any questions you have? Checkups at your doctor. If you're pretty healthy, that's usually just annual visits, but otherwise just checking in with them to make sure everything's going well and you are taking medications that are right for your body. Really, really important to prevent very serious things. So I am a little bit early. There's more time than the 7 minutes for Q&A. If anyone has questions to ask a doc or multiple docs over there, any questions you have? Yes.
Hi, can you repeat it again, please?
I was saying, I didn't hear, maybe I missed it. You say anything about alcohol beverages. So is that a new thing now? Is it a good thing to drink now or not? I just want to know.
Okay.
Just asking for a friend.
Yes, no, I get you. So that is something that I could have talked about. I actually could have added a slide for alcohol. And I see that you like to have fun at home too. So alcohol is one of those things to talk about for sure. So I know that there might be some things out there like, oh, a Mediterranean diet, like a glass of red wine every day with dinner, like that's actually going to keep your heart healthy. So I'm going to start with that saying like there's not as much research out there showing the red wine is actually going to keep your heart healthy. But I will say you don't have to stay away from alcohol, but make sure you're drinking in moderation, okay? So if you're drinking more than 3 drinks a day, if you're a guy, or 2 drinks a day if you're a lady, then that's too much alcohol for the system. Alcohol itself, it can affect the heart, but for us, primarily, it does affect the liver more commonly. And the heart and the liver, they provide blood to each other, so you affect one, you're going to affect the other. So if you're drinking a lot of alcohol, so the more than 3 drinks a day, especially if you're drinking regularly, that can cause issues with your liver. So it can also cause high blood pressure because of the way that it affects, your body and your brain. So I would say you don't have to stay away from alcohol, just drink in moderation. There are other very serious health issues if you're drinking too much alcohol. So something called liver cirrhosis or cancer, it puts you at higher risk for that if you're drinking a lot of alcohol. So I wouldn't say drink it every day either, because it's something about drinking it regularly also increases your risk. But you can have your celebratory wine every once in a while. If you'd like. And then also if you have heart failure, if you know you have heart failure diagnosis is another reason to either stay away from alcohol or also just take it in moderation too.
Are there different risk factors for someone who's been diagnosed or told they have congenital heart failure?
There you are. I was looking for you. So are there different risk factors if someone has heart failure? Is that the question? So a lot of the risk factors are actually the same, because similar things like if you have heart failure and high cholesterol levels, high blood pressure, all of those things can cause you to be at higher risk for having a heart attack. Having heart failure as a diagnosis itself means that your heart is weaker, so that also has its own risk towards having a heart attack or having other issues with your heart, like cardiac arrest. So that in itself is a risk factor for these medical emergencies as well. Heart failure in itself can land you in the hospital for something called a heart failure exacerbation, which means that either fluid is pulling in your lungs or your legs or any other part of your body that's causing you issues in your daily life. And that in its own is going to put stress on the body. And while you're in the hospital with dealing with your heart failure, that can lead to further stress on the body, further stress on your arteries and veins, and increase that risk for heart attack, stroke, and all of those things too.
Okay, sorry. My question is regarding this canola oil. Because once while he was saying it was bad, it wasn't such thing as canola. And I took totally it out of my diet, totally it away. Because, kept on saying it's bad, it's bad, it's bad. Use olive oil, instead, in fact, to stay away from it. So what changed to make it good that is now listed that we can use?
Yeah, I mean, I can explain some of that, but I think our dietitian will actually have a bit more information about that from in general. So comparing the different fats and oils that you use in cooking, us in healthcare say that if you can use oils that are liquid at room temperature, it's healthier for your heart and your arteries. I say that because things like butter or shortening or things that are solid at room temperature, it's going to be solid in your arteries and veins if it starts to pool up. So it's actually healthier to use those things called unsaturated fats that are liquid at room temperature because it's healthier for arteries and veins, and those things actually increase something called HDL, which is the happy cholesterol. So we can talk a bit about cholesterol too. There are some numbers and all those like funny little acronyms that you might see at the doctor. So one is total cholesterol, which is the total amount of cholesterol in your body. One is LDL, so that is considered the bad cholesterol. If that number is high, that puts you at higher risk for cardiovascular disease because that's considered the bad cholesterol, the one that's going to build up in your arteries and cause plaques and heart attacks and strokes. The other cholesterol that we see is something called HDL. We consider that H for happy cholesterol. So those are the like unsaturated fats, the healthy cholesterol and fats that you need for your cells in your body and your brain to use that energy to keep functioning. So a certain amount of cholesterol is good. It just depends on the type of cholesterol. So for those things, usually those healthy fats are going to be omega-3s, like olive oils. I'm trying to think. I'm having a brain fart. But like olive oils, there's another kind of oil that people like to use a lot. Canola oil is the one that's kind of like in that middle. So I'm sure our dietitian will give us more information about that. But because it's liquid at room temperature, that's why we're saying that it's a bit healthier than going out and putting out like a spoonful of butter onto the pan to cook our foods for dinner. Any other questions? What was that? Avocado oil, that's the one. That's the one. That's also very healthy and full of omega-3s and healthy fats. Coconut oil, another really great one. Grapeseed oil, perfect. Look at y'all, yeah. This is great, this is great. Anything else? Okay, well, thank you for letting me talk to y'all and hopefully not talk your ear off about heart health and the medical side of things, but it really is a pleasure to be here, to be able to educate y'all on things to look out for in an emergency. And, okay. And kind of be aware of those warning signs and other ways to keep your heart healthy. All right, thank you guys so much.
Thank you so much for all your insight. We really appreciate you. Round of applause one more time for her, please. Thank you so much, doctor. Thank you. She's going to be around here. If you have any other questions, please reach out to her and ask her the questions that you might have. Now, I did want to pass the mic real quick to Harris Health. They want to talk about a survey real quick.
Hi, everyone. Thank you for sitting in our Let's Talk Health Clinician series. So we have a brief survey inside of the folders that we're asking you to complete for us, and we'll come around and pick them up. Thank you. And you can keep the pens and the folders.
We love a free pen. Yes. Okay, well, now I did want to introduce the registered dietitian that's here today to answer all your other questions that you might have, Mariana Rendon. She is a part of the Nutrition and Physical Activity Program. Thank you, Mariana.
Hi, Joanna. Thank you. Okay, hi, everyone. My name is Mariana, and I'm a registered dietitian with Harris County Public Health. And today I'll be talking to you about 10 ways to improve your heart health. So this presentation is based on the handout from the American Heart Association, and it's in your baggies that y'all have. So you can take it home with you and look over these tips that the American Heart Association shares with us. And while I'm doing this presentation, I would like you all to just think about if these are some things that you already normally do in your daily routine. And if not, maybe just think about one that you think you could start doing in the next week or two to help improve your heart health. So the first tip that the American Heart Association gives us is to balance our calorie intake with physical activity. So whenever we talk about calories, so food gives us calories, right? But calories is actually energy. So whenever we eat, we get calories, which means we get energy to do our daily activities. Just wake up, go to work, come home. So whenever we're eating the amount of calories that we need to carry us through our day, if we're not eating any more or any less than the energy that we need, that's when we have a stable weight. So we're not gaining weight or we're not losing weight. But sometimes if we're taking in too many calories or too much energy for the amount of activity that we're doing, that's when we can see things like weight gain. If we're taking in too much energy but not actually using it. So one strategy to help with that, of course, is physical activity. And I know our doctor talked about this too, but the recommendations are to aim for 150 minutes of physical activity a week. This can look like 30 minutes, 5 days out of the week. So you don't even have to do it every day. It doesn't even have to be an hour, just 150 minutes total. So we have two types of physical activity. One of them is aerobic activity, which you all might be familiar with. It's sometimes referred to as cardio. So that type of activity gets our heart pumping, beating harder, and our lungs working harder. So we're breathing a little bit harder than normal. So cardiovascular or aerobic activity helps improve our heart health. It helps us lower our blood pressure and also helps increase the good cholesterol or HDL. Examples of activities that are considered aerobic can be like walking, jogging, dancing, bike riding, swimming. We also have another type of activity called anaerobic activity, and that's just a fancy name for activity that helps us strengthen our muscles. So the recommendations for this type of activity are to do it at least twice a week to help with our muscles, and that helps improve our blood glucose control as well. So examples of muscle strengthening activities, I know a lot of the time we think directly like, oh, lifting weights, like I have to go to the gym and lift weights, but that's not necessarily the case. We can do muscle strengthening activities at home with resistance bands, even doing like some yoga, using our body weight, that can also help strengthen our muscles. Another thing that the American Heart Association recommends is to adding a variety of fruits and vegetables to our diet. So fruits and vegetables, we hear this all the time, but they really are super beneficial, right? They have vitamins and minerals that nourish us. They have antioxidants, which are little compounds that help us heal our body if there's any damage to it. So it can help with preventing things like cancer. And I know our doctor mentioned that fruits have sugar in them naturally, but they also have fiber. So whenever we eat fruits, we don't digest them as just any other sugar. That fiber helps slow down the digestion, so we're not actually spiking our blood glucose as much. And fiber is one of my favorite nutrients. It actually also helps lower our bad cholesterol. And fiber is found not just in fruits and vegetables, but also whole grains and legumes. We'll talk a little bit more about that throughout the presentation, but this is a good reason to include fruits and veggies in our meals. And in terms of fresh, frozen, or canned, really any type of fruit or veggie that we include is good. So if you can only do fresh or frozen or canned, whatever the case may be, that's fine. The only thing to look out for with our canned or like our packaged fruits is to make sure we're getting those that don't have any salt added or any sugar added. And a good rule of thumb is to include fruits and veggies at every meal. If possible, making half of our plate fruits and veggies. So tip number 3, incorporating whole grains. So I have a little picture on the screen. You see on your left side, there's a whole grain, and on your right side, you have a refined grain. So what is the difference between the two? If you notice, the whole grain has 3 parts. It has the outer part, which is called the bran. It has the middle, the endosperm, and it has the germ. The refined grain only has 1 part. So when we look at the whole grain, it has the bran. The bran is the part that is full of fiber and a lot of B vitamins and minerals. The middle part, which is the endosperm, is our more starchy carb part, and it does have some protein as well. And then when we look at the germ, that has, it's a good source of healthy fats, again, vitamins B and E. But if we compare it to a refined grain, we're only getting the endosperm. So we're only getting the starchy carb. We still get some of the protein, but we don't get all of the protein that a whole grain would have. So a whole grain is overall more nutritious because it has that fiber, it has B vitamins and vitamin E, it has minerals and healthy fats. Whereas a refined grain is missing out on that fiber and the vitamins and minerals. So a good way to incorporate whole grains into our diet is just replacing those refined grains. So trying to include 100% whole grain bread, whole grain pasta, whole grain crackers, oatmeal, and popcorn is actually a really good source of whole grain as well. It just depends what we top it with, right? Because if we're adding butter and salt, it's not going to be as heart healthy anymore. Number 4 is focusing on our healthy protein sources, and the American Heart Association actually recommends prioritizing our plant-based proteins and our seafood. So whenever we're talking about plant-based proteins, that means our beans, peas, lentils, unsalted nuts and seeds. And especially with beans, chickpeas, lentils, that not only has protein, it also has fiber. And like we said, fiber helps us bring down our bad cholesterol. With seafood, there are some that have that are more rich in our healthy fats. For example, salmon, sardines, mackerel, black cod, that has omega-3, which are essential fatty acids that help us with our heart health as well. If we do, or when we do eat other meats, trying to go for the at least 93% lean meat to reduce the saturated fat, which we'll talk about in a little bit. And overall, just minimizing our processed meats like bacon, ham, beef jerky, sausages. So now, I know we had a question about the liquid oils. So echoing what our doctor said, the American Heart Association recommends unsaturated fat. So unsaturated fat, those are fats that are liquid at room temperature. These oils have healthy fats that help lower our bad cholesterol and our risk of heart disease. Especially with canola oil. Canola oil has a good mix of our omega-3s and omega-6 fatty acids. So those are essential fatty acids. What that means is that our body can't make those on its own. It needs to get it from food. So canola oil is a good source of that. Olive oil also has other types of healthy fats. And we can also find healthy fats, not just in these oils, but in fish, nuts, seeds, tofu, edamame, for example. On the other hand, we have saturated fat, and that's the one that's solid at room temperature. So examples include butter, tropical cooking oils, so that includes coconut oil. If it's solid at room temperature, that's one of the ones that we want to limit. These do raise our bad cholesterol and increase our risk of heart disease, but saturated fats can also be found in fatty meats or full-fat dairy. So the best recommendation is to replace those saturated fats in our diet with unsaturated fats. So it maybe instead of using butter, I'll start using canola oil to cook. Okay, the next thing is to eat minimally processed foods. So looking at the screen, right, we have on one side we have an apple, and on the other side we have apple pie. So we can tell that this apple has gone through some changes to get to what it is as an apple pie. With the apple itself, it has the skin, so it has fiber, it has natural sugars, vitamins, and minerals. When we get to an apple pie, sure, it still has some fruit, but we know that they added sugar. This was fried, so they added fats, maybe even salt. So these processed foods tend to be high in what we mentioned, sodium, saturated fat, added sugars, which in different ways affect our health. So the more we can stick to foods that have not gone through processing and had these nutrients added to it, that'll be the most beneficial for us. Okay, so minimizing added sugars. As our doctor mentioned, managing our diabetes or our blood glucose levels is also a good way to keep our heart healthy. And we do have recommendations for limits of how much added sugars we should stay below in a day, right? So for men, we have 9 teaspoons max, which is 36 grams per day. And for women, we have 6 teaspoons max per day. So this is what we would like to stay under. And some common sources of our added sugars, as you'll see on the screen, we have our sugary drinks, flavored milk, sports drinks, sweet teas, juice, and fruit drinks as well. We have our sweetened breakfast, so cereals, energy bars, granola, yogurt too. A lot of the time, if we're not buying that plain yogurt, if we're getting like the strawberry flavor, it doesn't always have natural strawberries in there. It doesn't have natural sugar. It'll have like a syrup to make it more sweet. So that's something to watch out for as well. And then with our syrups and sweets, so anything that was not present in the food or drink originally is considered an added sugar. So if I'm drinking coffee at home and I'm adding like a teaspoon of sugar, it's still considered added sugar. So that's just something to keep in mind. But of course, whenever we're preparing it at home, we can at least control how much we're putting in there. If we're going somewhere and buying it, we usually don't really know how much really goes in there. Any frozen treats like ice cream, frozen desserts are common sources of added sugar as well, and sweet baked goods. And the American Heart Association does recommend, if you are trying to limit your added sugar intake, especially to manage your diabetes and your blood glucose levels, it is okay to use a sugar alternative, a non-nutritive sweetener to help bring that sugar in your diet down. But ultimately the goal will be to replace those sweetened drinks with water, whether that be plain, unsweetened sparkling water, still water, just to reduce those added sugars. And tip number 8 that we have is to cut down on salt. I know our doctor also talked about it a little bit. So I just have an example of why do we have to limit salt? How does that affect our blood pressure? And the way I remember it is that water follows salt. So if we're eating a high salt diet, we're going to have high levels of salt in our bloodstream, which is going to pull more water into our blood vessels. And that's going to increase the pressure of that blood as it travels through our blood vessels, which can damage them, weaken them, just increase our risk for building plaque, just weakening our blood vessels, and it also makes it harder for our heart to pump blood throughout our body. So with salt, the limits that are recommended is 2,300 milligrams or 1 teaspoon a day. So when people hear this, it sounds very low, just 1 teaspoon. But one thing to remember is that most of the salt in our diet comes from processed foods, not really from us cooking at home and adding salt to our dishes. So if we're able to reduce our intake of restaurant foods, fast foods, anything that's been packaged and preserved, that'll really bring down how much salt we're taking in our diet. Another good thing to look for is, especially when buying canned items, looking for reduced sodium, no salt added labels. So I included an example of just our regular green beans. Right? It doesn't say anything about salt or anything, so we can just assume that that's like the baseline amount of salt, but we can also look for some that say 50% reduced sodium, that's the one in the middle, or no salt added, that's the one in red all the way at the end. Another thing, if we don't see the salt labels on the front of the package, we can always look at the nutrition label and look for the sodium line and check that the percent is closer to 5. If the percent is closer to 5, that tells us that that product is low in sodium. If it's closer to 20, that'll be considered high. So just looking for those percentages that are closer to 5. And if for whatever reason you're not able to shop for these reduced salt added, reduced salt cans, you can still, a good way to reduce the sodium is to rinse whatever we're eating, rinse before we eat so it can wash away some of the salt. And just trying to flavor our foods with herbs and spices. And our body, our taste buds will adapt. So we'll get used to eating less and less salt until at some point we might even think foods taste salty. So if we make these changes, our body does adapt. Maybe not initially, but it will. Tip number 9 is limiting alcohol. So as our doctor mentioned, drinking too much alcohol can raise your blood pressure. So if you don't currently drink alcohol, the best thing to do is to not start. But if you do drink, the recommendations are to stay below 2 drinks per day for men, below 1 drink per day for women. And on the screen, I have what is defined as a drink. So 1 drink is defined as a 12-ounce beer, an 8-ounce malt liquor, 5-ounce glass of wine, or 1.5 ounces of 80-proof liquor. And the last thing to remember is to follow these recommendations at home and when dining out. So on the screen, I have an example of something that we might eat out that looks like a soda or a milkshake. We have our double patty hamburger, and we have our fries. So what can we do to make this a little bit healthier? So 1, maybe we can switch our side of fries for a salad or a fruit. So what does this do? It increases our vitamins and minerals and fiber that we're eating for the day, and it also reduces our salt intake and our fat intake. If we replace the double patty, we're substituting red meat for chicken, so that reduces the saturated fat. If we substitute the milkshake or soda for water, then we're getting more hydration. We're also reducing our added sugars. If it's a milkshake, we're also reducing our saturated fat. So these are things that we can, keep in mind when we're eating out as well. So yeah, those are my references. Like I said, I would like you all to maybe just think about what is one thing that you could try to implement in the next week or 2 to help improve your heart health. And if y'all have any questions, I am here to answer them. Thank you. Thank you. No questions? Okay, well, y'all can feel free to take that little handout home and review it, and just pick something that you'll work on in the next week.
Mariana, thank you so much. She's here today, so please stop her. Do you bite, Mariana? Do you bite? Yeah, bite. Can they come ask you questions?
Yes, of course.
Okay, so please take, she's here right now. Take that opportunity to ask her any question that you need. There's no dumb questions. I always need help when it comes to the registered dietitians. I ask her, so is this a good amount of salt? Can I eat these chips because of the salt? She would go, Joanna, remember, we have to be careful. How about we eat this other type of chips, right?
Yes, exactly. Making substitutions where we're able to, and some salt is okay. We're definitely going to get some salt in our diet. It's just being mindful maybe of those higher salt foods.
Okay, thank you so much, Mariana. I appreciate you. Please take advantage and go talk to her. Round of applause. She did an amazing job. Now, one thing that I did want to let you guys know, please take advantage as well of our awesome vendors right now. This is an opportunity where you can go and talk to our vendors, learn from there, take resources back home. In a little bit, when the chefs are done cooking, we will start giving out the food for you guys to try. But I will give clear instructions on that, asking you all back to please sit down whenever we're ready to hand out the dishes. But right now, you can go ahead, go outside, play with the little animals that we have, come talk to our awesome vendors, and then I'll come back and ask all of y'all to take a seat so y'all can try the dishes and vote for the best heart-healthy dish of 2026.
Hello again. My name is Veronica Ajewale. I want to say a big thank you to each and every one of you for joining us for today's program. I am very certain that you have received a lot of great information that you will put to practice as we all grow together to become a healthier community. Thank you to our speaker and our panelists. Thank you for sharing today's content with us. Thank you to our locations. Thank you to our interns, our volunteers, to our sponsors and our funders. Thank you also to the staff of our program, the faculty, and the leadership of Texas Southern University for supporting us in making today's program a success. Most importantly, I want to say thank you to each and every of you, the community members. We appreciate your support. We do not want today's program to end just with today's event. We want you to continue to collaborate with us and engage with us. Our social media platforms are located at CECTX Southern U. On those platforms, you will find engaging information from today's program and all the other programs that we have going on in the Community Engagement Corps. So we implore you to continue to stay connected with us, engage with us as we move forward together in building a healthy and a wealthy community. Thank you for joining us, and we look forward to connecting soon. Bye.